Sir Patrick, thank you for joining us. The first question for you comes from Chandra, who asks, how come in Germany they have been able to do so much more testing than the UK and keep deaths so low?
I think there are two bits to that. I mean, they have done more testing than us, and I think that is something we absolutely need to get right. There's no question, in my view, testing is an incredibly important part of how we need to manage this going forward. It was something that we raised right at the beginning as something that needed to be in place, and we need to get more testing. That's happening at the moment. I don't think that you should equate the testing, though, and the outcome in Germany. There are all sorts of reasons. I mean, there may be a relationship between the two, but there are all sorts of reasons why rates may be different in different countries. And I don't think testing alone is the major reason for that. And so we need to understand why outcomes are so different in some different countries. That may have to do with things like the concentration of people in cities. It may have to do with things that are to do with demographics, age structures of populations. It may have to do with other things on top of that. So yes, testing, there's a lot that we've got to get right on that. And it is being looked at now by Public Health England and Department of Health, and they are getting that right. But I don't think it's as simple as to say lots of testing saves lives, because that isn't quite right, I think.
So you don't think we got the testing wrong in the UK at the beginning of this?
Well, I think the testing at the beginning was at the right level. I mean, I think at the beginning, Public Health England got off to a good start in terms of testing to try and make sure that they caught people coming into the country with it. I then think it's not scaled as fast as it needs to scale, and that's being done now. But I do think testing is an incredibly important bit of this. It needs to be done at scale, and it needs to be done rapidly enough to be able to look at outbreaks and isolate. And I think it's been good in terms of what's been able to be done in hospitals. It clearly hasn't been at the scale that's enabled all the healthcare working testing that's an important part of this. And I think that's why it's so important it does get into the right position now.
Bernard wants to know, do you think if we had gone into lockdown weeks earlier, it would have saved a lot of lives?
I think the question about when to go into lockdown is a really important one. And if you remember, we went in quite early compared to some other countries, and the lockdown became quite a severe lockdown in terms of the social distancing measures. If we'd gone into that, say, a month earlier, I think we would have probably spent a few weeks with absolutely nothing happening. Very difficult to know exactly what the effects on the outcome would be. I think that it's important that we continue it long enough. I think that's really, really important, that we don't just suddenly say victory, remove it immediately in totality. So I think the next phase of this is understanding how and when to release these measures in a way that's safe. And clearly, this is a nasty virus. It's a pandemic. It's across everywhere. It's very noticeable in the Northern Hemisphere across a certain range of countries. And we, amongst other countries in Europe, have obviously suffered badly with this virus. There's no question about that.
A question now that's come in from us from Anne. She asks, is the government still pursuing the policy of herd immunity that you personally and publicly were advocating in mid-March? If not, do you regret pursuing it when we should have been locking down earlier to save lives?
Well, let me first of all be crystal clear that we were never pursuing a policy of herd immunity. The points that I was making at the time was that at some point you need to get immunity in order to stop getting infection. And there are two ways in which immunity occurs. One is with a vaccine, and we're pursuing very actively the notion of trying to get a vaccine, either one that would come from some of the researchers in the UK or one that comes from overseas. The worldwide endeavour to try and get vaccines, or you get some immunity because people have caught it, and clearly there's a little bit of immunity in the community because of that, but not a huge amount. And it's not possible to build up lots of immunity quickly with this disease for all the reasons we've seen. So that's not possible. So the herd immunity comments were really about trying to understand the fact that you need to get immunity at some point in order to stop this. That remains true, that's the way we stop this, or we end up with effective therapeutics. What we laid out at the beginning was a plan as to when we need to introduce the social distancing measures and to do that at scale across the population. And that was very carefully thought about in terms of timing. And we'll understand whether we got the timings exactly right or not. It's absolutely regrettable that we've got so many cases and deaths in this country, as indeed there have been in lots of European countries, some with higher death rates than us, some with lower. But I think we didn't lose time in terms of understanding what needed to be done, and in terms of making sure that those positions were clear.
Anna wants some clarification on your role during the pandemic. She writes, we're constantly reassured by the government that they are following the science. Would you agree that the science is open to interpretation and that that interpretation of the science can be political? Are you neutral on this, Sir Patrick?
Well, I completely agree that this is a difficult scientific area. It's a brand new virus. The world hadn't seen it before. We've got an entire population across the world that's never seen this virus and has no immunity to it. And the whole of the science community is learning about this day by day. So it's not the type of area of science where you have absolute pre-baked facts that are just facts. It's something that we're learning about all the time. And in that context, that's true for all of the science advice that's gone in. It's gone in with, of course, the caveats and the uncertainties clearly expressed.
Raj wants to know, do we know if there is a disproportionate incidence of coronavirus amongst ethnic groups, and what should be done about it?
Yeah, that's a really good question. And it does look as though there may be some. And that's something that we're looking at very carefully to try to understand. And it's obviously, particularly noticeable amongst some of the healthcare practitioners who we've seen who've unfortunately succumbed as a result of this. So that is a key question that's being looked at now, and trying to understand what might underlie such a difference.
Sir Patrick Vallance, thank you very much for joining me. Thank you.
Thank you.